like talking about the irregular periods. Some people have delayed periods. I was even speaking to one of my friends yesterday. She said, make sure you ask them. I started when I was young, my period lasted for 5 days. But once I got older, it went down to 2 days. Is that normal?
In terms of periods, I think the most important thing to understand is what a normal period is. And a normal period varies between person to person in terms of the cycle length. So your cycle length is basically the time you have from one period to the next period. And typically that's around 28 days, but it really does vary from person to person. And then you have the actual menstruation, which can vary again from person to person, a few days, 5 days, 7 days. But I think what is important to realise is when it's not, what is definitely not normal. Yeah. So if you're bleeding regularly, then you're having regular periods, whether it's only a few days or slightly longer, as long as it's roughly the same time, same distance between each period, that's normal. But I think it's important to realise that there are symptoms that are not normal. So bleeding in between your periods is not normal. Heavy, painful periods, again, it does happen, but if it's, you know, excessive, again, that's not normal as well. And yes, to answer your question, periods can change. Periods are really sensitive to so many things. So they're sensitive to other medications that you can be taking. They're sensitive to your weight, for example. So if you gain weight or lose weight, your periods may change. It's also sensitive to what you're eating as well. And also stress. Stress is also a major one. So if you go through stressful times, your periods may change as well. So they may be reasons why your periods can change through the years.
So Nina, do you see people coming to you to ask for medication for their periods and stuff?
Yeah, so because I'm a prescriber pharmacist, so I do get, say if somebody can't see their GP, I do get patients who come in, maybe they want to go on holiday and they want to stop their periods. They come in and get there's a drug called norepinephrine, something like that. Yeah, take that 3 times a day for 5 days before you're actually expecting your period. And what it does is it holds your period. I usually recommend it to be used for 10 days and no longer than 10 days. But yeah, people do come in for help to adjust their period, and also for pain relief and for over bleeding. So some people have very, very heavy bleeds, sometimes due to fibroids. Sometimes it's just, I think, a hormonal thing. Some people have heavier periods than normal, and we're able to give medication to control that. If somebody's bleeding, though, and they do come in and it's heavy and they don't have a reason for it, so they don't know that they've got a fibroid or they don't know the reason for their heavy period, I always encourage them to see your GP. Knowing that there might be a problem is something that you need to reaffirm with somebody through a scan or through a scan or something like that. So I do get people come in with help for their periods and advice. And as Adwoa said, diet is I think diet's one of the things that we kind of tend to ignore. During your period times, you want to stuff your face with sugar, but you shouldn't actually do that because it can make your periods worse. It does this so if you're eating a lot of sugar, if there's any inflammation anywhere, it makes it worse. Hence, you'll be cramping over or toiling over more than usual. If you stay away from the sugars, you might not get as much pain. So that's another.
During that time, that's definitely true. A nibble on sweet stuff as well.
Yeah, that's when your body's craving. But sometimes you must tell yourself, I think everything in balance. I mean, you can't do without it completely, but you shouldn't overindulge. Otherwise, you're going to pay for it later on. So, yeah.
Adwoa, were you going to say something?
I was just going to say that's absolutely true. And the other thing that we know is exercise actually helps with periods. I mean, that's the last thing that anybody wants to do when they're in so much pain. But even just going for a brisk walk or going out and, on the treadmill, whatever, it does definitely help because, exercise, we know, releases happy hormones, which can actually reduce how you sense pain as well. So you could get into kind of a routine. Once you get into a routine or a habit, it definitely does help. But I think Nina's absolutely right. You know, there are lots of treatments available. You know, we have to really stress that, because like I said at the beginning, it's not, you shouldn't be having time off work and not being able to function properly, because there are perfectly reasonable, good medications that will potentially change people's lives, that are easily accessible. So don't suffer in silence. And again, Nina said, you know, it could be fibroids. You could go through your whole life, or your whole adult life, having painful periods, and then, you know, you don't actually know that you've got a huge fibroid, because you've just kind of been wearing two super pads and a tampon and changing every hour. You wouldn't know. So sometimes these symptoms are trying to get your attention to actually do something about it. So don't put it off, just get it checked out. If nothing's there, then that's great, but you should know for yourself.
So we've been talking about fibroids. That's something I would also like to talk about. When do you think it's advisable because I've had people that have gotten them removed, and some doctors also advise that there's no need for you to remove it if you're not ready to have kids, unless you're having problems whilst you're trying to conceive. So I want to know more about it, in terms of when do you think it's advisable to have them removed?
I'll let Nina go first.
I was going to say, personally, I've got fibroid. Apparently it's small one, but my periods are getting a bit worse. I'm suspecting it's growing. But fibroids, I think, should be left alone if you want to have children. That's just me personally. And after you've had kids, you can get them removed, because there are ways of managing having a fibroid. There's risks that comes with removing them. I'm not saying that if you remove them, you're definitely infertile and stuff like that. No, but you never know what's going to happen during the operation. You can be scarred. The procedure might not go as right as you intended for it to go. I've heard of cases where I forgot what you call it now, someone's ovaries were, like, you know, tampered with, like, during the process. Things can go wrong. So I would say use other medication. So manage the bleeding. So it's management, basically. Manage the bleeding, manage the pain. There's ibuprofen, there's mefenamic acid, there's tranexamic acid. These things will help to manage it. And then allow you to family plan. And after you family planned, you can remove it if it's causing too much trouble. So that's just my opinion on it. I know that there are other drugs, actually, that shrink fibroids. You can only use them for 6 months, though. And I think there are some side effects. That's why you can only use them for 6 months. And I think it's fairly new. And with these new drugs, you don't actually know what the full side effect is. So you're kind of a guinea pig too when you start using it. So I would just say the management of it is best. And when the fibroids do shrink with that drug, there is a possibility it can grow back, and it can grow back bigger. So the options are there, but you have to weigh the pros and cons. But personally, I'd manage it, and then after having a family, when I decide that, you know, it's all right, I'd get them removed.
I don't know if you're allowed to mention the drug's name, the ones that shrinks the fibroids. I don't know if you're allowed to.
There's so many. I think I wrote one of them. 1 second. I wrote one of them down. I think it's specialist prescribing, though, by a gynecologist. I'm going to look through it, and when I get it, I'll.
Okay, sure.
Yeah, I think I mean, it's interesting that you have fibroids and what you've said about surgery and things like that. I think what I would say about fibroids is that it's like a spectrum. So some people wouldn't even know they have children. They go on to have many children, and they wouldn't even know that they had fibroids. And then you've got kind of the other scale where people have really large fibroids that can. So basically, what we should explain is that fibroids are like non-cancerous growths are in and around the womb, so where you carry the child. So some are within the wall, some are actually inside the womb as well. So depending on the location of where they are, it may or may not cause you more problems. And also the size. So we know that Afro-Caribbean people are more likely to have fibroids and also more likely to have sizable fibroids. So, you know, I've seen people who have fibroids the size of an actual child, so they looked pregnant, you know. So when you have such large fibroids that are causing pressure symptoms, so if you imagine you can put pressure on your bladder, so you keep going to the toilet, it can put pressure on your bowel, so going back, so constipation issues, it can put pressure up, so you would have sort of reflux symptoms, stomach pains, back pain because of the size, diarrhea, vomiting, then yes, you know, and also it's going to cause obstruction. So if you're trying for a baby, you're not going to conceive because it's so big, it's getting in the way. So in those instances, yes, we would really recommend, you know, removing the fibroids. And I think with fibroids and removing fibroids, you hear horror stories. Generally, the way people are made up is people never go around saying great things. Oh, I had my fibroid removed and it's excellent, now I've got a child. People will say, oh, did you hear about what happened to Mary? She had a fibroid out and then they took out her ovary instead, or something like that, which is very rare, you know. But people generally only talk about negative things, you know, when it comes to these things. So I always say that when it comes to fibroid surgery, yes, it is at times a big operation, but we wouldn't recommend it unless it was beneficial for you. And also making sure that, you know, with any operation there are risks, and we have a duty to inform of what the risks are. And if you have any questions, definitely ask about, you know, what's the likelihood. I've had many women who have had their fibroids removed and are doing extremely well as well. But then I also have women that don't want their fibroids removed, which is fine, but we are trying as best as we can to manage their symptoms without surgery. In some cases it can cause miscarriages because as the fetus is developing, if there are really large fibroids, there's nowhere for them to grow, so then it can cause a miscarriage. Again, not very common as well. The other thing I should mention is that as we get older and enter into menopause, the fibroids do naturally shrink because of the depletion of certain hormones as well. So that's important to mention as well.
So we've been talking about fibroids, so I wanted to also bring up polycystic ovary syndrome, which I don't know much about. So is that similar to fibroids as well?
Adwoa. yeah, I was going to say, I don't want to keep it talking, but yeah, polycystic ovaries is very different to fibroids. So also called PCO or PCOS. So all women have 2 ovaries, 1 on each side, and the ovaries produce eggs, or basically produce eggs and store eggs. So if you have polycystic ovaries, you have several cysts around the ovary or inside the ovary, which in most cases don't cause many problems, but in some cases when you have multiple cysts that can sometimes, they're really tiny generally speaking, but sometimes they can get much bigger and burst, which causes pain, and also we know it can affect how you produce eggs because they're around the ovary where the eggs are stored. So you may have irregular periods, or you also may have other difficulties with your fertility. So you don't necessarily produce eggs as frequently or at all. You may have no periods or very little periods. And also we know because of the hormone imbalance, you may have issues with weight and acne, and also excessive hair growth. So hair on the chin, moustache, on the chest, on the belly. So excessive hair growth as well.
Oh, okay.
Yeah.
So you were talking about you wouldn't know about releasing eggs in terms of polycystic ovary syndrome. Would you say that relates to ovulation as well? Does that come under ovulation?
Yeah.
So when does one know? Okay, sure. I think she gets the response.
No, go for it.
So when does one know if they are ovulating or even releasing eggs? How can one tell?
Oh, Nina, do you want?
No, I was gonna say, so ovulation, that comes with the cycle, like having periods. So as Adwoa said, with polycystic ovarian syndrome, you won't have a regular cycle. So you wouldn't be releasing eggs every month, a monthly period. When you know you're ovulating is, well, firstly you have a period, and halfway through your cycle, that's when you usually ovulate. Around everybody's cycle length is a bit different. So halfway through that cycle, that's when you know you're ovulating. And the signs that you are ovulating may vary from person to person, but generally speaking, the stuff that comes, the mucus from down below is more slippery. You might get stomach cramps, not like really bad cramps, but just the discomfort in your lower abdomen. Any other ones, Adwoa? Those are the two ones I know of.
I think they're most common, but the majority of people, what you won't know that you're ovulating.
You won't really know, yeah.
But
it's not
some
obvious.
people can say that they can feel that they're ovulating, but most people will have no idea or feel that they're ovulating. But we know it happens, as you said, halfway through the cycle.
So you can, between day 10 to day 14, I would say, when everybody generally ovulates, but it just depends on the length of your cycle again.
Yeah.